Hi, everyone. I hope you're well. Today, I'm going to talk to you a little bit about intergenerational healing and community work. There is a huge problem of isolation and a gap in generations. So, the generation of youth and the generation of the elders, there's this huge gap, and we're suffering from that, and we don't really realize it sometimes. The elderly generation is suffering from a lack of understanding or even acceptance sometimes of what the social or technological developments of this present day are currently serving as a reality. And the generation that is youthful is suffering from this big gap of wisdom from the elders whose shoulders we stand upon. And it's so important to come together. These are things that stress the body out, and even these gaps can cause illness sometimes, which is really, really sad. Loneliness is a huge factor in stress and disease, and intergenerational programming can unite communities together and promote healing in this way, which is really beautiful. There are many different approaches when it comes to intergenerational healing. A lot of them have to do with arts or movement therapies, something that brings the community together for a common goal. This could really look like anything. So whether it's art projects, storytelling, body mapping, dancing, singing, drama, or spiritual events, the community can benefit by being together in this intergenerational setting with a common goal. This has been around since the Paleolithic times, these types of art and drama therapies that promote healing. So this was already established as a modality of healing for communities when communities in Paleolithic times got together and had ceremonies and community gatherings. Everybody was there, the children and the elders and the generations in between. So this is something that has been around for quite a long time and has been a foundation for community bonding. After World War II, the arts began to be an integrative therapy for traumatized veterans as a means of releasing stress and navigating just difficult emotions and traumatic memories. And then in Europe, integrative arts became an educational model to help foster sensory development. So it was around this time, after World War II, when these types of modalities began to be recognized as therapeutic methods within communities and intergenerational work. And in 1969, graduate programs began to emerge for art and healing programs. They were originally under an organization called American Association of Artists and Therapists, and it was later renamed to National Expressive Therapy Association. Anybody is able to participate or guide an intergenerational activity. However, because of some of the illnesses or burdens that come into that space, it's really important as somebody who's engaging in intergenerational activities that whoever your guide is has adequate training. So even if that's just support from institutions, educational institutions or geriatric facilities or therapists or nurses, it's really vital to have that support if you're not adequately trained as a therapist or a nurse, or have these credentials that back you up, that you have support around you that can make sure that the health and well-being of the participants is being cared for appropriately. So as previously stated, art forms are really relevant in common goals. So whether this is dance, drawing, painting, theater, yoga, culinary skills, poetry, anything can create this common goal nature across the generations. A program that models this was called the Participatory Action Research Method, and this took place in West Philadelphia. And it was aimed to research the benefit of dance for public health across a variety of generations. The study ran over a duration of 5 years and included community members ages 8 to 73 to participate in community dance classes. Obviously, there is some support there, right? So for the younger children to, have their attention engaged the whole time, there is support there. There are additional teachers, and for the elderly participants, there are nurses present and modifications given to fit this wide age range. So what they found was there were a couple of prominent themes. They found an engagement in mental health and self-confidence across the board, all ages. And additionally, there was an element of fun and community socialization, which can mitigate that isolated loneliness that I previously mentioned. An intergenerational model that used art therapy and place mapping as a means of bringing communities together found similar benefits in regards to healing. This program used participants from a nearby school and a senior institution center in order to research the health benefits at community levels, intergenerational activities. In this particular study, art making and place mapping were chosen to target the emotional, geographic, and social components of the program and the community. So they found a psychological and emotional cathartic release. The purpose of this program required them to use art-based activities. They were themed and prompted by the idea of health and wellness. So, for example, some of the pictures were prompted by asking the participants to draw a place that made them feel happy. And interviews were used to collect data for this study. And the data showed that social gaps were bridged, self-confidence, again, another common theme, was boosted, and an overall sense of well-being was derived from lessening the social gap and engaging with participants of all different ages. So there is this theme of healing, of joy, of social engagement within intergenerational programming that is focused on healing and working together, common goals, experiencing skills, mentorship, and wisdom that is passed down from generations, and education with technology or socialization that maybe the youth can help with the elders, and having this attitude of acceptance that the elderly generation has so much to pass down to us. Myself speaking as somebody in the younger generation, we have a lot to learn, and anybody can participate and benefit from these activities and programs. They're especially useful in treating anxiety, depression, dementia, and Alzheimer's. They've shown there's been great benefit in those types of conditions, and we need to bridge this gap of knowledge. We need to bridge the gap of knowledge and loneliness. Again, we stand on our elders' shoulders, and the elderly community needs communities around them that have that life and vitality, that youth, and we need to embrace and accept what intergenerational studies have to offer us, and programmings, as we need to bridge the social gap of isolation, going in with a humble spirit and a willingness to embrace vulnerability and bridge these gaps. Thank you.